Hi everyone, it's me, Melanie, your IVF nurse, and today's topic is going to be about clinic closures for the holidays. Now, I know many of you may be with clinics that are closing for the holidays, and you're probably seeing a very big rush, or it's very, very busy at the clinics, maybe a little bit busier than it normally is because everyone's trying to get their cycles done before the closure. So just bear with me. What I'm going to do is be talking about the clinic perspective of a holiday closure, as well as from a patient perspective, and also what you'll want to know before your clinic closes. If you're early pregnancy, if you're waiting for pregnancy test, what you'll need to do over the closure, okay? From a clinic perspective, when the clinic closes over the holidays, by no means is it anything to say upset you or piss you off. A lot of the times what happens is that when the clinic does close, sometimes the doctors actually leave the province and go away for the holiday season, and sometimes they will shut down the clinic because that's when the clinic will do some necessary improvements that they can't do when the clinic is open and operating because the volume of patients is too high. Things like painting, steam cleaning carpets, maybe the floors need to be replaced, or stuff like that that needs to be done. Also, the labs usually have a thorough cleaning as well, and they want to make sure that all their incubators are empty and that everything can be done. So new year, fresh start. So you do want to take into consideration, if you do have a clinic that is closing, these are the reasons why. The other thing is as well is that sometimes it's a good break for the staff, and unfortunately staff, they all look forward to the holiday closures. However, patients do not. So if you're with a clinic that is open during the holidays, then you're very, very fortunate. If you're with a clinic that is going to be closed, then what you'll need to do is a few of the following things. For one, depending on where you're at in your protocol, so if you've just completed an IUI cycle or an IVF cycle, or even a frozen embryo transfer cycle, if you are pending your blood test for pregnancy, you want to make sure that if the blood test is during the closure, that on the requisition that it does state that the lab may release results directly to you, the patient. And that way, when you're going to have the blood drawn, you will either enroll in an online registration to be able to obtain your results online, or you'll obtain the phone number where you could call in and get your results. One key thing to remember is that over the holiday season, some labs do modify their hours. So if you're going to a CML, Life Labs, or Gamma Dynacare, then you'll want to check to make sure what their holiday hours may be, so that you're not going there and say they've already closed early for the day. Now, in terms of medications, you do want to make sure that you've got everything you need to get you through that closure. And I believe most times it's about 2 weeks, but you do want to check with your clinic and make sure you've got enough medications. So if you are getting your medications from a pharmacy, you want to make sure that there are enough refills on those prescriptions to get you through the holidays, or at least until the clinic reopens. If you're getting your medications directly from the clinic with your supplies, so if you're doing progesterone and oil injections, you want to make sure that you have enough to get you through the holiday season. A lot of the times when the clinics close, there is no one there to be checking emails, answering phones. There is no after hours line. It's a complete shutdown. So you do want to make sure that you've got everything that you need to get you through that holiday closure. If you are newly pregnant from your IVF or IUI cycle or frozen embryo transfer cycle, then what you'll want to do is make sure that you've got enough medication, as I just mentioned. You'll also want to make sure that you've got instructions if something should happen. So in the event that you are newly pregnant and say you have bleeding, if you normally have an after hours line that you could call, who are you going to reach out to? Do you just go to Emerge, or is there something else in place that maybe the doctor or the medical director of the clinic has arranged to do? So you do want to check with all those things before the clinic closes. If you're with a clinic that is closing for the holiday season, then it is recommended that you do stay on course, continue with your prenatal vitamins. If you're taking CoQ10, anything that the doctor has prescribed, you do want to continue that. Same thing, any lifestyle changes that you've made in your journey so far, you want to continue to do. And then also, you want to take the time and actually enjoy the holidays. So if you're spending time with loved ones, you want to be able to really enjoy that. And sometimes taking a step away when the clinic closes gives you that opportunity to kind of look around and see maybe all the things that you've missed and not thoroughly enjoyed in your journey, because it can be quite consuming. So doing that, making sure that you get enough rest over the holiday season, regroup for January, because it's going to be a busy month when you start calling that clinic. Depending on how soon they're reopening the lab will determine how soon you can get in to start doing your cycles again. Here's wishing you a very happy holiday season. Please feel free to check out my website, www.yourivfnurse.com, or you can email me at yourivfnurse@gmail.com.